today our topic is osteoporosis. What it is, what you can do about it, how you can avoid it, and if you do have it, how can we reverse it if possible? How can we support proper bone metabolism? What are we supposed to avoid to set ourselves up in a good situation? So for those that don't know, osteoporosis is the loss of bone density. So your bones have two types of cells in them. One of them is called an osteoblast. Those osteoblasts will build bone. And the other one is osteoclasts. Osteoclasts are cells that will take away bone or remodel bone. And we need both of them to have a healthy, proper strength of our bones and density of our bones. It's not just the density of the bones that matters, it's the strength of the bones. And we need both of those cells to be working in order for that to take place. So in a person who has osteoporosis, they may have lost a lot of the minerals. So we want to have strong bones, and that's what this whole video is about. How can we have strong bones? So if you're someone who has osteoporosis, currently the treatment is medication. And we want to do our best to avoid having to be in that situation of medication. It's been estimated that after age 50, half of the women will have a bone fracture after age 50. Half. So that's everybody out here knows someone who has osteoporosis. And after age 50, it's 25% of the men will have a bone fracture from osteoporosis. So it's an important situation. So as far as medication is concerned, the way that things used to be treated, and some people still are treating this way, is with estrogen replacement therapy. And that has been shown to be an absolute disaster for people. It causes people not to be healthy at all. You can look into all the studies on that. But the reason why they used to use estrogen is because it would slow down that osteoclast activity. So if the osteoblasts are still building the bone and osteoclast activity is slowed down, by using that scenario, the thought was that the bone density would increase, because if we're building more than we're breaking down, that we'll have more bone density. And that sounds great, except for the fact that estrogen will also cause an increase in prolactin, which is another hormone. And prolactin has been shown to accelerate bone destruction. And the net effect was negative, not to mention all the other side effects of estrogen. So that's not used as much, but that line of thinking is still taking place. If they thought, well, if we can slow the osteoclasts and keep the osteoblasts working, we'll have more bone. Well, then they thought, well, how can we inhibit those osteoclasts from working at all? And that's when they've come up with the medication that are the bisphosphonates, things like Fosamax. And those things inhibit the osteoclasts. So now those things aren't working. And when those don't work, then the osteoblasts will build up. So that does a really good job in the short term as far as building bone density. So in the first couple of years, you'll see that the bone is actually denser. But the research shows that if you're on that for longer than 5 years, the actual strength of the bone has been diminished and decreased dramatically. Some studies say up to 1,600%. So your risk of fracture after being on that for long term is very high, very high. So these are very dangerous drugs, very dangerous medications, and just be careful and learn about them and talk with your doctor about that and ask about these questions, because long term it's probably maybe not the best idea. And if we could do something naturally before we get on medication, or God forbid if you're on medication now, we can take some action naturally, then maybe we can change the whole situation. So that's what we're going to talk about. So despite the fact that those medications are used, in the past 30 years, the incidence of hip fracture from osteoporosis has more than doubled. So we're missing something. We're doing something wrong, right? So let's prevent things while we can, and if we're in a bad situation, let's try to reverse it as best we can. So what are things that we can do to increase and improve our bone density? Well, number one, it gets boring after a while, but a proper diet. Okay, when I say proper, everyone has their own view of what a proper diet is, but in regard to across the board, I think everybody can agree that more vegetables is very important. If you can eat specifically green leafy vegetables, and even onion has been shown to increase bone density, but lots of green leafy vegetables and vegetables in general will also alkalinize your tissue pH. That will help things. So eat lots of vegetables, eat more vegetables. If you are doing a bad job eating vegetables, then cheat. The way you cheat is you get a green drink. They're in all health food stores, but not all of them are good. If you want to call and ask us which ones we recommend, I suggest you do that. But get a green drink that has dried up vegetables, and take that every day. Take that 2 times a day, 3 times a day. Whatever you need to do to increase your amount of vegetables, you need to do that. Whether you're eating them organically and raw or sauteed, that's fine. Just add in that green drink if you need be. Protein, adequate protein. We need to have enough protein. It's been shown that low protein diets will contribute to osteoporosis. And there also has been some talk about high protein diets, high meat diets, increasing the amount of breakdown of bone in the urine. Whereas that is true, the absorption of these things, of all those nutrients, will increase in the colon, in the small intestine, when we eat more protein. So it's been shown clearly that adequate amount of protein, you have to have enough of it, is important. So eat enough protein. Fats. I love fats, and you should love fats too. However, we've all heard of the good fats versus the bad fats, but I don't think anybody really knows what the good fats are, right? They're not those polyunsaturated fatty acids that you get from vegetable oil. They're not the things that most people have been eating for years. We've been told to eat unsaturated fats for a long time. However, those have been shown to cause the person to have more incidence of osteoporosis. So avoid those. Eat the good, healthy fats like coconut oil, like avocado. Grass-fed meats are a great source that you'll be able to have. Even liver. And we'll get into some of the supplements you might take. If you're not going to actually buy liver and eat organic liver, which I don't do, then take it in supplement form, which is one of the things that I do. And I think everybody should take that, because we all need support with our liver living in this toxic world. So those are the fats. So polyunsaturated fats, avoid those. What other things can you avoid? Oh, sugar. I think we say that every single week. Sugar. Just don't eat sugar. Don't eat the cookies and the donuts and the cakes. Just throw it out. If you have osteoporosis, for sure you have to stop those things. And grains, other grains, especially gluten. We talked about this here as well. Go gluten-free. If you have osteoporosis, you need to go gluten-free for sure. In fact, you should probably give up all your grains if you're gluten-free, if you have osteoporosis, because that's been shown to push calcium and minerals out of the bone as well and contribute to osteoporosis. So if you have this condition, you need to do everything you can to help. So the reality is grains, including gluten, will turn into sugar. Sugar is not good for us, and your body will process that, and it'll put you in a bad position. Processed foods. Processed foods are also full of all sorts of garbage. So get rid of the processed foods. Eat normal, healthy food from the outside part of the grocery store, not the packaged products from the inside and from the interior. Okay, so things to also to take. So we all have heard that we should take calcium, right? Well, calcium is important, sure, but it's not the only thing. The only reason why we only hear about calcium is because the dairy industry pushes that so hard. Yes, calcium is important, but we also need things like magnesium and boron and vitamin D. Vitamin D3, that is, not synthetic vitamin D, but all these vitamins and minerals I'm talking about, I suggest that they're from an organic whole food source. K2 is super important for bone building. In fact, you won't be able to rebuild your bone without vitamin K, so add vitamin K in as well. Manganese is another nutrient that we need to have. So take all those things in, and you ask yourself, well, how am I going to do that? How do I know what's in what? Well, you can cheat again, and the way that you cheat is to take this in supplement form. We have whole food supplements that have all those things in it from natural sources, and they're a really great way to make sure you have everything that you need, and you don't have to worry about eating the right foods, which you should be trying to do anyway, but that way you're getting the things that are proper for your body. With regard to minerals, if you're taking minerals, they are rendered almost useless if you're taking things like proton pump inhibitors, like Prilosec, or if you're taking Tums, and on the Tums bottle it says calcium, it has got calcium in it. Well, that's great, but Tums neutralizes acid, and calcium is absorbed in an acidic environment. So you're not what you eat, you're what you absorb. So if you're taking those things, that's a problem too. And those antacids have been shown to contribute to osteoporosis too. So if you're on them, maybe you should get that fixed. Get that reflux fixed. Watch my reflux video and take action on that. Other things you should avoid if you have osteoporosis: fluoride. So some water sources are fluoridated. Some people brush their teeth still with fluoride toothpaste. Avoid that. Throw that out. If you have thyroid disease especially, throw that out. But fluoride has been shown to increase the incidence of osteoporosis as well. So avoid it. Get a good filter that filters fluoride and add back in minerals. I like to use these ionic minerals, put them right in the water. It makes the water taste really, really good, and it gives you the minerals. So you can drink that all day long. So I know I'm getting the minerals that I need. We also use pH salts as well to help our acid-alkaline balance in our bodies. We want to be as alkaline as we can. In addition to that, we have specific supplements that we would use for people with osteoporosis. Take these supplements to the amount that I would suggest with regard to your weight, and you're getting the raw materials that you need to rebuild back in bone. And if you can do that while you're avoiding all those other bad things like grains and sugar and polyunsaturated fatty acids, then your body can heal. That's what our bodies do. If we put it in the right environment, our bodies will heal. The other thing you want to avoid if you have osteoporosis or osteopenia, or if you are concerned about that happening in your life, which you should be because so many people break bones after 50, avoid steroids. So, if you have, certain infections, or you have, a lot of doctors use steroids for a lot of different reasons. So do your best to avoid them if possible, because they're going to contribute greatly to osteoporosis as well. Other things to do: check your thyroid. There are hypothyroidism has been shown to increase your incidence of osteoporosis as well. So get it checked. The whole thing, not just TSH. Get the full thyroid panel. So you want to check TSH and total T4, free T4, total T3 and free T3, T3 uptake and reverse T3. Make sure you test them all, otherwise you won't really know if you're hypothyroid or not. And if you are hypothyroid, get that fixed as well, so that way your whole body will be healthier. Other things to do: strength train. So exercise is important. If we can put force onto our bones, we can stimulate those osteoblasts to work better. Remember these guys? So if you can do some weight-bearing exercise, it's fantastic. It doesn't matter what age you are, but if you need to, get someone who knows what they're doing. Get a trainer. Do some squats. If these things are too hard on your knees, do what you can and get a professional's help, because there are certain bones that are more at risk than others. We want to make sure we stress those bones as best we can, so that way they can build and remodel and get stronger. I'm not sure if I mentioned bone broth in this, but if I didn't mention bone broth, that I would suggest that's a great thing to do too, because you want to have the constituents of bone, right? So eating that bone broth or drinking it every day is something that can make a difference for you as well. So I think if I could have forgotten anything on this, I don't think I have. If you have questions about this, then write them below, write in the comments. If you find value in this, if you think it might help other people, then share it, like it. If you share it and tag 2 people, then again, you can be entered into that contest to win the TV, and in 6 weeks we will be able to give it away. Now, if you're somebody watching this on recording and it is after December 7th, 2017, and let's say it's 2020 and you're watching this, well, you missed it. So don't worry about winning any TV, because it ain't going to happen after that. So if you are before that and you're watching it live or in the next couple weeks, then like it, share it, and you will get entered into that contest. Vitamins. If you don't know what vitamins you should be taking, then I suggest you go get a blood test or call our office and come here. We'll give you a blood test. Not a blood test with just a cholesterol and your, CBC and one basic chemistry. We want a real blood test that's going to give us a whole lot of information. We can run that test, and then from there we can look at you and tell you what supplements we think you should take and be a healthier person for it. So again, thank you for supporting us. Thanks for watching. I appreciate it, and I hope that this gives you value. I hope that it saves a fracture from happening in somebody. Even if it saved one person from doing that, then it would be worth it. I hope that truly happens. Thanks again for watching, and tune in next week. We will come at you again with some hopefully relevant, helpful information. So thanks for watching.